Hi, everybody. I'm Donna Andersen, author of Lovefraud.com, and I'm here today with my good friend and colleague, Dr. Liane Leedom. Dr. Leedom is a professor of counseling and psychology at the University of Bridgeport, and she is going to be presenting skills training for recovery from abuse, gaslighting, and toxic stress, which is a program, as it sounds, to help survivors overcome the experiences of being with a disordered person. So, welcome, Dr. Leedom. It's so good to see you.
Oh, yeah, thank you. And I hear that title, I feel so excited. I hope it lives up to its name. Well, I
Okay,
think it will. I'm
wonderful.
looking
So,
forward to everyone's feedback about it.
good, good. So, how will survivors benefit from this program?
Almost everyone that I have talked to says that life did not prepare them for this experience and that it's a shock to them and they're having to learn a whole different way of being in the world. So, my purpose here is to beyond imparting knowledge to help people practice skills that are going to enable them to thrive in the life after this relationship or thrive despite whatever connection they're forced to maintain with the disordered person.
So, you call the program skills training. What do you mean by that?
Just that, that managing very strong emotions, managing the thoughts that come up with respect to the deception and the gaslighting, managing how to be sure you're grounded in reality again. All of those things require skills, as well as people ask me, how do I beat these people at their own game? And I don't know that that's possible, but I'm going to go over some skills for how, this is the final module, but how to um, deal effectively with individuals who are disordered to the degree that that's possible.
Okay, so you've told me that this program references the concepts of dialectical behavioral therapy or
Right,
DBT. Can you
right.
explain how or what the relationship may be?
Yes. Well, this is a form of cognitive behavioral therapy, which was the most common therapy that most of the people that have been in our surveys have been through. At least in terms of people who have been through an evidence supported treatment, cognitive behavioral therapy is the most common. So, dialectical behavioral therapy is a form of that, but it has added layers to it that make it very good for trauma survivors. And the layer that we are going to be focusing on is the skills training. Some of the skills training teaches cognitive behavioral techniques for managing strong emotions. So I'm hoping that some of the listeners will already have experience with that, and we will help them apply that knowledge to themselves within um, their recovery process. So that's the first thing is the skills training. But in addition to the skills training, I'm hoping to experientially impart, and I say that going beyond just words. I'm hoping to experientially impart a philosophy of life that will assist in recovery. And part of that philosophy of life is dialectical. And what dialectical means is living with the massive. a number of contradictory statements that survivors have to contend with. So, the first one being, part of me loves this person and part of me hates this person. That's a dialectic. So how do we live in that space between the feelings of love that may still be there and the profound hurt and damage that these people do? And then how do we, another dialectic is, I love myself, and yet I'm disappointed in myself that this happened to me, and that, I allowed this. People often say that, I allowed this to happen to me. So how do you negotiate that dialectic? So there are many, many opposite truths that we're going to have to bring together. And doing that starts with the idea of accepting the fact that two things that seem to be contradictory can be true at the same time. So that's the extent to which this is dialectical. And also there is, I think you have spiritual beliefs and I have spiritual beliefs. How do we integrate those spiritual beliefs into our recovery in a way that's empowering and yet grounded in reality? So I'm hoping people will get a taste of how to do that, how to integrate in their own spiritual beliefs, because it's been my experience that most of the people recovering that I've talked to have spiritual beliefs. So how can those beliefs strengthen a person?
Okay. And how might this be different to or similar to other therapy experiences or recovery experiences that survivors may have had?
Well, this is not meant to replace individual therapy. It's meant to give skills that the person can talk to their therapist about using. And I hope that most of the people will be in some form of individual therapy if they need it. So the focus on skills is the main difference. And the way the skills are packaged in this treatment has a lot of research behind it. And so, for example, a number of our survivors struggle with substance abuse after their victimization. And that's understandable. These skills are known to help that population in their recovery from the substance use. It's not uncommon that people are recovering from victimization and substance use both at the same time. So the skills focus. And these are a proven list of skills.
Okay. So this, a lot of what we're going through is evidence-based, correct?
Yes.
Okay, good. All right. Well, so do you have any messages of encouragement for folks who might be thinking about taking this skills training?
Yes. And I'm sure you would probably also say this, Donna, that I've been doing this for long enough so that I've had the joy and the privilege to know survivors over years and years and years. I mean, there are people that I've known for 15 years now. And people can't recover from this experience, and they end up wiser from it. And
Yes.
this,
Yes. Go ahead.
yeah. So I hope, so I'm hoping, my goal is that these skills will cause that process to happen faster for people. That a lot of the skills that we're going to be talking about are skills that people picked up on their own. In fact, when I started going through these skills again after my victimization, I started saying, yes, that one, these are things that I did all the time, every day. And so people may also get encouragement from that of, hey, yeah, I figured this out and I'm doing that already. So that's good. That's validation that what you're doing for yourself already is going to work for you.
Well, I am so excited, and I know that recovery is possible. You and I have both recovered from serious victimizations, and I've seen plenty of other people recover too. And so I also want to echo that message of hope that there is a better day ahead, and it requires effort on your part, and this is one way to go about doing it.
Right.
Okay. All right, Dr. Leedom, thank you so much, and I look forward to the beginning of this training.
Yeah, me too.
Okay.